The first session is going to actually be from our major medical organizations. And we have three wonderful speakers, each representing a different facet of medical practice. I'm proud to say that our first speaker is from the American Academy of Pediatrics, but furthermore, he's from Rochester, New York. You watch anybody who is making an impact in this world today has been in Rochester. Dr. Thomas McInerny is the immediate past president of the American Academy of Pediatrics. Now, that doesn't sound like very much, but with all these organizations, you got to be on the board, and then you have to be a vice president and anticipatory president, and then you spend a wonderful year as president. And Tom was very effective. I think he's become best buddies with Obama. Is that correct, Tom? And so it's almost a lifetime commitment. But so Tom has finished his term, but he's still speaking up for the American Academy of Pediatrics. He's been in private practice in Rochester for over 40 years. He's also a professor of pediatrics at the university and associate chair of the Department of Pediatrics because he is our liaison to the community. When Tom speaks, our practitioners listen. And he's had also, like our other physicians we've mentioned today, he's a graduate of Dartmouth College, Harvard Medical School, and did his pediatric residency in Cincinnati and further at Children's Hospital in Boston. He's also the editor of the American Academy of Pediatrics textbook on pediatric care and has been on many committees and won many awards and is most beloved by all of us in Rochester. Dr. McInerny.
Thanks very much, Ruth, for that kind introduction, and it's a pleasure to be here and a pleasure to have known Ruth Lawrence for 40-some-odd years, which is only a short period of time for her, but for me it's been a long period of time. Anyway, and to know of her absolutely fabulous work in improving breastfeeding throughout the country and the world. So it's a great pleasure to be here and be speaking with this group. I'd like to talk a little bit about breastfeeding and early brain development because we're beginning to learn some very important things about that. And the Academy of Pediatrics is promoting early brain development as one of its planks in its agenda for children. I have no disclosures. So just briefly, I'll show you our agenda for children, our icon, which is our strategic plan. Of course, we are dedicated to the health of all children. And in the outside of the encompassing circle, we have health equity, the medical home, and the profession of pediatrics. And then our three pillars are access, quality, and finance. And they support our current agenda items. And the ones that we have that are now underway are early brain and child development was the first. That was about 3 or 4 years ago. Epigenetics followed that. Children, adolescents, and the media last year, and then this year, poverty and child health. All very important, and I'd like to talk a little bit about the links that we see between breastfeeding and most of those planks in our agenda. A little bit about the Academy of Pediatrics. We have this is our office, by the way. Headquarters are in Elk Grove Village outside of O'Hare Airport. We have 62,000 members, 66 state and local chapters, 30 national committees, 49 sections, 6 councils, and 450 employees. Most of those are in Illinois and Elk Grove Village. We do have about 18 or so down here at our legislative office just a few blocks away from here. We have our AAP section on breastfeeding, which was established in 2002. We have 500 members in that section, 78 chapter breastfeeding coordinators who promote, protect, and support breastfeeding in their state chapters and communities. We address the breastfeeding needs of infants, children, and families and communities, and supporting AAP members through breastfeeding advocacy, education, research, policy development, and promoting systems through which members deliver breastfeeding care. We have our AAP breastfeeding policy that was redone in 2012, and I noticed that at your fourth summit, you had someone from the committee that put this together came and talked about it. But we reaffirm our recommendation of exclusive breastfeeding for about 6 months, followed by continued breastfeeding as complementary foods are introduced, with continuation of breastfeeding for a year or longer as mutually desired by mother and infant. Very, very important that first 6 months at least, and hopefully we can see more and more mothers doing that. We have numerous resources for both physicians and parents on breastfeeding. We have a couple of online resources such as aap.org breastfeeding and healthychildren.org. By the way, healthychildren.org, I'll mention that briefly. This is a news magazine for parents that we started about 2 or 3 years ago. We get 1 million hits a month on healthychildren.org. And last May, we started publishing a Spanish version, healthychildren.org in Espanol. And that has taken off dramatically, not only here in this country, but also in Latin America as well. We also have a Facebook on breastfeeding. As you know, we got to keep up with all the new media. And then we have different pamphlets and for both physicians and patients. And very importantly, we have our breastfeeding handbook for physicians. We also have some posters that we have available for pediatricians to put in their offices. One is about obesity prevention, and the other about breastfeeding babies' first immunization. So those are all available for our members. Now let's talk a little bit about early brain and child development. And it's all about nurturing relationships and how important early relationships are in building children's brains and our future. We're really beginning to understand, finally, I think we're getting the message across to policymakers in the country that the children of today will be our workers in 20 or 30 years from now, and we need a healthy, well-educated workforce in 20 or 30 years if we're going to compete in the worldwide market in a very tough economic climate. And we can't ill afford to let a large percentage of our children not be well educated or healthy. We're beginning to understand some of the science of early brain development and note that brain architecture is experience dependent. Both individual connections such as synapses and complex circuits of connections depend on activity, and that activity is stimulatory activity between parent and child. Ecology, which is environment and experience, influences how brain architecture is formed and remodeled. That leads to plasticity. And recent scientific advances in driving paradigm shift in understanding how child development impacts health and disease across the lifespan. So the ecology, early social environmental experiences, and biology, genetic predisposition, influence the development of adaptive behaviors, learning capacities, lifelong physical, mental health, and future economic productivity. So the question that's been going around for many years, what's more important, genetics or environment? And the answer is yes. They're both extremely important, and there is a complex interplay between the two of them that lead to optimal development. Now, there are many implications to this, and that is to translate the game-changing advances in developmental science into effective policies and practices for families with children to improve education, health, and lifelong productivity. Critically important, as we say, the first 1,000 days of life, the first 3 years of life are critically important. Now, what's very interesting is that our second item, or our second on the plank on our agenda for children is epigenetics. And many of us, including myself, didn't know what the heck epigenetics was about until we finally learned a little bit about it. And what it does is it gives us the biological, scientific underpinning for what's happening with early brain and child development and in the interplay between environment and genetics. So epigenetics defines, aligns, and promotes genetics, genomics, and epigenetics within the AAP and pediatric care delivery. It builds knowledge and skills in this area and addresses systems and clinical issues to help integrate genetics, genomics, and epigenetics into pediatric practice, and it enables and advances further research. So just as an example of that, I was able to find a reference about epigenetic effects of human breast milk. And this was a recent publication by Bandelieri et al. From the University of Milan in Nutrients, Volume 6, Number 4. And here's a quote from this. While evidence suggests that a direct relationship may exist of some components of breast milk with epigenetic changes, the mechanisms involved are still unclear. Studies have to be conducted to clarify the actual role of human breast milk on genetic expression. So here's a great area for research, and I think we will find for sure there will be some direct connections. We're finding that epigenetics is critically important in ways that we hadn't even begun to think of, and I'm sure that breast milk will be part of that. So parenting as primary prevention. During the first few years of safe, stable, and nurturing relationships to promote healthy brains by decreasing toxic stress and encouraging the foundation of mental skills. We know from studies about adverse childhood experiences and toxic stress that children who are exposed to 4 or more stresses throughout their early childhood have poorer health with shorter lifespans, increased diabetes, increased tendency to smoke or alcoholism or engage in drugs and unhealthy sexual practices. And in addition, those children have emotional and behavioral problems which interfere with their ability to learn and affect them throughout their lifetime and leads to increased emotional behavior problems as adults as well. So it's very important that we try and avoid adverse childhood experiences and improve the environment at home to make it more amenable for children to grow healthy and to develop well. Early maternal support exerts positive influences on hippocampal development. We've seen studies that show that, and obviously breastfeeding is a critically important way to show early maternal support. This parent-caregiver support is so critical because it turns off the physiologic stress by addressing physiologic needs. That's the Maslow levels, protection, levels 1 and 2. It also turns off physiologic stress response by promoting healthy relationships and attachment, Maslow levels 3, level 3, relate. And encourages foundational coping skills as they emerge, and again, Maslow levels 4 and 5, nurturing. Early childhood professionals are ideally placed to promote purposeful parenting and advocate for a public health approach to toxic stress. Child development is a foundation for community and economic development, and creating the right condition in early childhood more effective and far less costly than addressing a multitude of problems later in life. This is where the old stitch in time saves 9, and certainly it's much better to prevent some of the adverse childhood experiences and their associated problems, and then having to deal with them once they've occurred. So here's some other studies that I run across I want to quote for you. Here's one down below by Belfour and others. Children who breastfeed for greater than a year had higher receptive language scores at age 3 and higher verbal and nonverbal intelligence scores at age 7. And another article by Dione and others, exclusive breastfeeding is associated with increased development of late maturing white matter, areas of brain associated with high cognition. And long duration breastfeeding is associated with increased gross motor, fine motor receptive language, and expressive language and visual receptor scores. Again, emphasizing the importance of breastfeeding. I think many of you probably know that already. And then here's another article by Bernard and others showing that breastfeeding for 6 months and cognitive development, 2-year-old cognitive development index is 3.6 points higher for breastfed infants, and the 3-year-old ages and stages questionnaire 6.2 points higher for breastfed infants. So the literature on breastfeeding and early brain and childhood development is documented in our breastfeeding handbook for physicians, and I'll read this. Improved long-term cognitive development in preterm infants has been correlated with being fed human milk during hospitalization. A meta-analysis of studies where a magnitude of confounding factors, including maternal education and intelligence, were considered, concluded that breastfeeding conferred significant benefit to cognitive function well beyond the period of actual breastfeeding. Now, our last plank that we've just started with is poverty, and we know that poverty affects children's short and long-term health in many, many different ways, and among them are increased emotional problems such as anxiety, depression, alcohol, tobacco, and drug abuse, and decrease in intellectual development, lower language scores, and school performance, and more chronic disease such as asthma, obesity, and diabetes. We know also that breastfeeding improves cognitive outcomes, even adjusted for socioeconomic status, and it promotes attachment, which buffers kids against stress. And I might add, as it's well been documented for many years now, also helps prevent many, many kinds of illnesses as well. So for those in a lower socioeconomic status, promoting breastfeeding would be very critically important to help prevent some of the negative effects of the low socioeconomic status. AAP has had many years of strong advocacy about breastfeeding, and a couple of our most recent ones is that we have supporting the Family Leave Act by Senator Gillibrand. I don't know how many of you have heard about that, but among other things, she's talking about increasing the minimum wage and also, very importantly, paid maternal leave to increase the likelihood of prolonged breastfeeding. We are the only developed country in the world that does not have paid maternal leave, and time is long overdue for us to do that so that we can encourage mothers to breastfeed for at least 3 and hopefully as long as 6 months. And hopefully Senator Gillibrand's act will become law in the not-too-distant future. We also have recently wrote a letter supporting legislation to provide breast pumps and support and counseling for families insured by TRICARE. They're unfortunately for the military, the TRICARE does not have an adequate system to support mothers in breastfeeding, and the AAP has asked that they enact some legislation to make sure that TRICARE does institute that. So I think together, working with you and others, we can create a culture of health and get children off to their best start. And thanks very much.